today I just wanted to talk about the Queensland Myeloid Genomics program. So this is a project under the implementation grant to really improve the prognostication of children and adults diagnosed with myeloid malignancies in Queensland. Essentially, myeloid malignancies sort of encompass a range of haematological malignancies ranging from very indolent conditions such as myeloproliferative neoplasms through to very aggressive conditions such as acute myeloid leukemia. And within each of these entities, how they behave is highly variable. Essentially, the only curative therapy for myeloid malignancies is an allogeneic stem cell transplant, which in its own right is associated with significant risk and morbidity. And so the crux of this project is really to better prognosticate whom should receive allogeneic stem cell transplantation, because I guess deciding the right patient at the right time is one of the key challenges that's currently unmet. So the project team encompasses a network of clinician haematologists from across the state, and there's representation from each of the major sites that treat high-risk haematological malignancy, in particular, AML. And I said there's some key members on the clinician team whom have expertise in the field of myeloid malignancy and genomics, and they are going to be co-chairs of the statewide MDT, which will process the data that flows from this project. And they are Stephen Lane from QIMR Berghofer, who has done a lot of work in leukemogenesis and the molecular landscape of AML. We also have Andy Moore, who's with us today from the Children's Hospital, who has expertise in myeloid malignancy in childhood. And Associate Professor Paula Marlton from PA, who will also be a co-chair. Importantly, the Pathology Queensland will provide the necessary genomic analysis, which will be, as we mentioned, a targeted NGS panel of genes that are particularly pertinent in myeloid malignancy. So the problem, as I've alluded to, is primarily around prognostication. However, just diagnosing myeloid malignancies is increasingly becoming dependent on on genetic testing. There's a number of entities which are not routinely part of pathology testing, which have been defined in international criteria. Secondly, the currently existing prognostic tools that we use to predict the prognosis of someone, the risk of relapse and survival, are really quite antiquated and based on sort of biological parameters such as white cell count and other parameters such as cytogenetics. And they continue to underperform, and we all see patients whom are said to have low-risk disease who very rapidly progress to an untreatable form of acute leukemia and succumb to it. And I guess the accurate diagnostic and prognostic data is essential, as I mentioned, in deciding whom should have an allogeneic transplant and when. And that's particularly pertinent because this treatment is associated with significant short-term risk. Many patients succumb to the transplant itself, and it has significant impacts on quality of life for some patients. So really picking the right patient at the right time is one of the biggest challenges. So the solution is that multi-gene somatic mutation testing has been shown to provide reliable and clinically validated prognostic data in myeloid malignancies. So the QMGP, as we've called it, will incorporate genomic testing into a current clinical practice using a model that promotes efficiency, collaboration and research. So the efficiency is really by means of using a targeted NGS panel of key myeloid genes that have been demonstrated to be affected in the vast majority of patients with these conditions. It's also an efficiency gained by using a currently already existing method of sample collection of diagnostic specimens of marrows that are currently collected through Pathology Queensland. And I guess using existing referral pathways and existing statewide MDT networks that exist. So the statewide MDT encompasses a number of haematologists from all sites with representation from paediatrics and adult haematologists, and I guess led by a group with expertise in the mutational landscape of myeloid malignancy. And I guess there's significant research, although this is an implementation project, there are research opportunities that flow from it by establishing this statewide network of collection of specimens and lots of clinical data. We can generate a significantly meaningful database, which is unique with other states that have attempted to look into this. Really don't have a statewide clinical network and a MDT to process this information. So that's one of the strengths that we have potentially in Queensland that would offer significant opportunities for, I guess, biobanking to flow from this project to look at further research opportunities down the track. So the benefits of the program will be to enhance prognostication, lead to better utilisation of stem cell transplantation, better informed choices between patients, families and their haematologists. And the ultimate goal is obviously to improve overall survival. So the cohort that this project will apply to is children and adults with myeloid malignancies, including acute myeloid leukemia, where treatment is intensive chemotherapy, but the risk of relapse after that chemotherapy is quite varied, and mutational analysis will help to guide what that risk may be and optimally choose the best consolidative measure, whether it be further chemotherapy as opposed to a stem cell transplant. Same for myelodysplastic syndromes, where current parameters frequently fail to recognise patients whom have said to have a favourable prognosis but very quickly end up with AML. And myeloproliferative neoplasms, in particular myelofibrosis, where again the outcome can be highly variable. Patients will need to be eligible for an allogeneic stem cell transplant to flow through this project in its initial period. And that's really where we're sort of having the maximal impact in this decision around stem cell transplantation. There could be implications for family members. If a pathogenic germline variant is suggested, this will just be testing for somatic mutations, and if mutations commonly associated with germline variants, particularly pertinent in paediatrics, are identified, then we are developing referral process through Genetic Health Queensland to appropriately, determine this, which is particularly pertinent in a scenario where a donor may be a sibling. So the operations of the project are that there's essentially a primary care provider suspects a myeloid malignancy and refers them to their local haematology service anywhere in the state, and as long as they're sort of being worked up in a public facility, they'll have diagnostic workup, including a bone marrow, sent to Pathology Queensland's Lab Central. There's an opportunity at this point for consent, particularly pertinent if, for research purposes, if biobanking is to be most successful. Pathology Queensland do the usual assessment of the marrow and use existing prognostic models such as cytogenetics, and then issue a report with a recommendation for NGS testing in specific disease groups. This then goes back to referring a haematologist who has the ability to request NGS from the QMGP, and if this is deemed to be clinically appropriate in the patient who's of age for transplant, and then this would lead to the targeted myeloid gene panel being performed, variant curation by Pathology Queensland, before coming back to the MDT, which would sit on a fortnightly basis and make recommendations based on the current prognostic information available and on the genetic data that comes from this testing. And then we'll have an opportunity, obviously, for data collection, and then a clinically annotated report will then flow back to the local haematologist, whom has the ability to participate in the MDT themselves by means of teleconference to refer their patient in. So this is the sort of pathway that we hope to have up and running, and we are in the processes of looking to starting testing in June